Great. Welcome, everyone. Whoever is joining earlier, we're very excited to have you all. We're going to give a few minutes for the participants to join, and we'll get started here soon. Great. It's 3 o'clock. Welcome, everybody who's joining the inaugural webinar series of our Social Connection webinar series presented by Blooming Health and Social Creatures. Thank you, everybody, for taking the time out of your day to join this webinar today. Today, the topic is to discuss the future of social services for older adults and how COVID-19 has really made us rethink senior care. I think all of us have gone through a lot during these times of COVID-19, but it has definitely affected our vulnerable populations, including the seniors, a lot more. And we are trying to understand as a whole on how we can better adapt and move forward with our learnings from COVID-19 as it still continues to happen. So I think this is an important moment for all of us to reflect and learn from each other. So that's the key goal of our webinar today. I hope you can take away from this webinar some learnings from your other colleagues here, the amazing panel that we've recruited here, and also some best practices on how do we continue to adapt and successfully deliver social programs to seniors in this more hybrid virtual and in-person world or more virtual world. We'll see. So we're excited for our amazing panel that we have here with Beth Finkel from the AARP New York. She's the state director there. We have Rose Perry, who's the founder and executive director of Social Creatures. We have Ellen M. Stutz, who's a senior program officer at Dorot in New York. And Dozine Guijar, who's the director of health and wellness initiatives at the Carter Burden Network. We are very excited to initiate the conversation with our panelists. I'm going to give one more minute for all the participants to join, and we'll get started here soon. All right, I think we have sufficient threshold to get started. To give everybody an overview of how we are structuring the webinar today, we will have an initial introduction of Blooming Health and Social Creatures and the panel here. And we'll then move on to a discussion where we would have moderated discussion with our panelists on key topics around the future of social services for older adults. And in the last 25 to 30 minutes of this session, we will be discussing questions from the audience. And please feel free to leave your questions in the Q&A section of the webinar, as you can see on your bottom right. And you can input the questions as we go, and we will look at the questions in the last 30 minutes and answer them. And the other part for you to remember is also a polling session that we will be launching polls throughout the session, because we also want to hear from the audience. We have a lot of community-based organization members joining us today. So we want to hear your voice as well on how your experience has been. So we will be launching polls throughout the session to hear from you. Please answer them as they come up on your screens, and I will remind you when the poll is being launched. Great. So thank you once again, everybody, for joining and taking your time today to talk about how we are all thinking around the future of social services for older adults. We have a gray tsunami coming at us, right? Even before COVID-19, we all knew that there is going to be a growing older population with more than, in 2034, we're going to have more older adults who are 65 years and above than younger adults who are 18 years and below. And this realization about our society is a very important one, because we want to help our older adults as they age in our society to be independent and to age with dignity. And as this responsibility is incumbent on us as our community, we need to be working together as a society to help our older adults as they age. And COVID-19 has been an important reminder for all of us on how we need to be taking care of the vulnerable populations, particularly being prepared for pandemics and being prepared in terms of our infrastructure, like the social services infrastructure needs to be improved, and therefore aligning as together as a community and community organizations and key stakeholders who are taking care of the seniors. So given this in mind, I think we are very excited to have a diverse panel here who also share the same mission as Blooming Health and Social Creatures. We're looking forward to hear all their input. To begin with, I wanted to give a brief introduction on who Blooming Health is. My name is Kavita Nyanasamanthan. I'm a co-founder and chief commercial officer of Blooming Health. Blooming Health is an organization that is working towards addressing social isolation and loneliness in older adults at scale in partnership with community organizations. We started on this mission a year ago, and our primary goal is to empower the community organizations and stakeholders who are already delivering social interventions effectively to older adults to take it to more older adults who are in need and can benefit from these interventions and are not able to access them today. So that's where we see the role of data and technology in empowering our community partners. Our founding team has 3 members, myself, Naman Gupta, and Nima. We all come from a diverse background of science, product, data, and technology, but we are united in our mission to support our older adults and helping our community partners in better supporting the older adults, because we all know the damage and the serious impact of social isolation and loneliness, which is to the tune of smoking 15 cigarettes per day. It's the health damage it can cause on our seniors. And this particular problem is a key passion for all of us. And we are very determined to address this by working with all of you. And in terms of the solution that we've developed, we want to support all our seniors irrespective of their comfort with technology. which is why we are delivering our solution using a simple cell phone-based text messaging interface. And this can also be delivered via voice calls as well. And we are looking to support our community organizations to better connect with the older adults to deliver various services that can address social isolation and loneliness. And there are 4 key pillars to our solution. Number 1, we want to help the community organizations and caregivers to check in on the older adults' social needs like meals and transportation in a more timely fashion and more proactively, so we can help the older adults at the right time and using the right resources. And secondly, as we move towards a more virtual world and as we all are adapting to this new era, the content and the different social programs are also shifting. So we want to help the CBOs remind and help the older adults also adapt to this changing world by linking them to virtual programs and others directly from their cell phone. So we want to help syndicate the content, not only from the community organizations themselves, but also other open source social activities tailored for older adults and also linking them to other cross generations. And then the third aspect is purposeful projects. We want to help connect older adults to other cross-generational partners with whom they can work on meaningful projects that can drive purpose, because we understand from our year-old research and focus groups that purpose is the key driving factor for addressing social isolation and loneliness in older adults and even all of us across ages. And fourth, we want to use data to empower this and help the organizations, again, support the seniors who are most in need at the right time, at the right risk level, and customizing that support. So thank you once again for joining us here. So at this time, I want to transfer over to our panelists to share their introductions as well and hear from them and what perspective they're going to be helping answer the questions today. So Rose, do you want to start, please?
Sure. Hi, I'm Rose Perry. I am a social neuroscientist and also the executive director and founder of Social Creatures. Social Creatures is an applied research nonprofit organization. Our mission is to ensure that anyone can stay socially connected with others, no matter the circumstances. A lot of our work does focus on science communication and public outreach related to the science of social connection, but we also have our own initiatives and programs as well. So one of our major initiatives is our Digital Safety Nets initiative. And we've been helping individuals, but also lots of organizations, community embedded organizations, transition to virtual strategies directly in response to the pandemic. And we also created a virtual fitness program called SITNESS, which stands for Seated Fitness. And this was originally designed for individuals with spinal cord injury so they could maintain exercise at home when everything switched to online strategies. But it's become hugely popular with older adults because it's a way to safely and effectively work out at home, and it involves people of all ages every week, so they get lots of cross-generational interactions on a weekly basis. So yeah, thank you for having me today, Kavitha.
Thank you, Rose. And Beth, do you want to please share your background?
Sure, I'm Beth Finkel. I'm the state director for AARP New York. I've been working in this field for 25 years, so I have literally aged in place. I am now the senior. AARP, I think everyone knows, is a membership organization. We have almost 38 million members across the country. And here in New York City, in the 5 boroughs, we have 750,000 members. In New York State, over 2.5 million members. And our work is really at 4 different levels. Number 1 is our advocacy, which I'm sure that you all are aware of. There is nobody out there that's fighting to keep Social Security, Medicare, Medicaid, and so many other programs and services from the federal government that we absolutely have to have in place, that we have a covenant with the federal government to make sure that they stay, not just for us, but for our children and our grandchildren and our friends and neighbors. We also have a large number of volunteers all across New York State who do community service and also do grassroots organizing and advocacy meeting with their legislators, sharing with them what's important to the 50+ population, because our members are 50+. And foremost in our minds is helping people to age with dignity in the place that they would like to age and how they would like to age.
Mm-hmm. Thank you so much for sharing that, Beth. Sorry, was on mute. And Ellen, could you please share your background?
Sure. Hi, everyone. My name is Ellen Amstutz. I'm a Senior Program Officer at Dorot. And Dorot is the Hebrew word for generations. Our mission is to alleviate social isolation among older adults. And we do that with a huge workforce of volunteers supported by social work and supportive services. In New York, we serve about 4,000 older adults and have about 6,000 volunteers, 2,000 of which are teens and families. So we're very intergenerational. The areas that I work with at Dorot that will contribute to today's discussion is we have technology programming, which we were actually operating before COVID, so that was timely. But we've been helping older adults get online, use technology to enhance social connections and get the resources that they need for independent aging. We have had a one-on-one technology coaching program, in-home face-to-face, which we can no longer do, of course. We also have a long-standing teleconferencing program that's been around for 30 years, and I'll tell you more about that. And I also work with our impact and evaluation throughout the agency, where we really look at how we are moving the dial on social isolation, what are our strategies and best practices to really make a difference in alleviating social isolation. So thank you.
Thank you so much, Ellen. Mm-hmm. Josine, can you please introduce yourself?
Yes. Good afternoon. Thank you for this opportunity. I want to thank Blooming Health and Social Creatures to serve on today's panel. I am Josine Gouchard, the Director of Health and Wellness with the Carter Burden Network. By training, I am a social gerontologist with a number of years of experience in the field of aging services. And with the Carter Burden Gallery, we're about to embark on our 50th anniversary. We were founded in 1971. We provide services to older adults on the Upper East Side of Manhattan and also the East Harlem community. We were founded to address the needs of older adults dealing with health and wellness, congregate meal services, case management, case assistance, and we're also one of Manhattan's contracted agency for elder abuse services. In addition, we have one of the only, to our knowledge, art gallery in Manhattan for older professional artists. So it's truly an innovative project. We serve nearly 5,000 seniors throughout our organization. We have 4 senior centers, one located on the Upper East Side, 2 in East Harlem, and 1 on Roosevelt Island. We're also one of New York City Department for Aging designated Innovative Senior Center, and we're open 7 days a week. So we are really looking at programs, and we love partnerships with other organizations to help enrich the lives of the seniors that we serve. So again, delighted to be on today's panel.
Thank you, everybody. We are really honored to have all of you on here. And we've had the pleasure of learning from all your organizations over the last year as we've embarked upon this journey to support older adults. So thank you very much for everything that you do. And thank you for your time today as well. So to begin with, I think I want to take a moment to reflect on the time, say January or even December last year, when all of us were still thinking about how are we going to better support our older adults. Like social isolation and loneliness was a growing problem that was increasing in awareness, and including Blooming Health, we were conducting research with end users like seniors and community organizations to understand the problem and how we are going to solve it. But come February and March, we started doing a pilot even before COVID-19 hit, and we had 4 older adults with whom we were conducting a pilot of the Blooming Health solution. And that was the peak of coronavirus. And we were able to observe the various emotions and sentiments that were affecting the seniors themselves as they were starting to digest what is going on around them, as they start to read the news about COVID-19, how they were digesting what is this new pandemic, and the growing paranoia to some extent on how they are supposed to be at home, away from everybody, and needs to be more socially distant to remain safe. So I think this has been nevertheless an emotional trauma for all of us, but especially for us seniors. So I want to understand and open the topic for discussion today to hear from you as community organizations who have been directly working with seniors for several years, as you said, over several tens and tens of years. And so you've directly seen firsthand how this pandemic has affected the seniors, but also how we have been preparing at the state level, at the city level, to prepare ourselves to support the community organization. So we are fortunate to have all those different perspectives here. So let's talk about it from all those different perspectives. So first, I would like to hear in terms of disease, how has your organization, how did you first start digesting the COVID-19 pandemic and its effect on how you deliver your services for the older adults?
Thank you. As everyone else, we were totally running to figure out how could we best serve the needs of our older adults. And when the New York pause order was put into effect, we went from providing 250 meals a day at one of our senior center congregate setting to we can't gather anymore. So we started looking at what resources do we have in-house and what partnerships could we form to be able to help the needs of our seniors. We have been engaged in various technology projects over the years, and out of every crisis, there comes a silver lining. And I would say out of this crisis had really helped us to form new ways of how we can reach out to the seniors. So what did we do? First and foremost, we pivoted, and I'm sure everyone has heard that word a lot over these last several months. We pivoted from congregate meals to grab-and-go meals. We went from grab-and-go meals then to home-delivered meals, which was actually provided by the New York City Department for the Aging. And so what was paramount for us throughout this entire period was the well-being of our seniors. They became somewhat disoriented based on not being able to see their friends. They build relationships with the staff. So what we did, grab-and-go meals were still an opportunity for us to stay engaged with the seniors. But when that particular piece changed, we then moved into using the telephonic and technology. So we have what we call wellness calls. Seniors would receive calls at least 2 to 3 times out of the week to check on them, to see how they were doing, to see what needs they had. Were they getting their food? We also then moved into more of a virtual world where we started offering Tai Chi classes, art classes. And then we said, what does all seniors have? All seniors have one thing, and that's a phone. We know that. So we then seek funding to implement the broadcast calling system, where we put into effect messages, but not a robocall, but literally individual messages that first our executive director, Bill Dion, gave the initial, I'm checking in, how's everyone? Want to make sure you have what we need. And then we started having these broadcast calls every week. And so we have well over 2,000 seniors who have actually participated in these broadcast messages. We had our board chair, board members also record messages, and they would get pushed out to our seniors. And we divided it in such a way where each center was able to identify their clients as well as doing a general broadcast. And what they said to us, the ability to receive a call from a familiar voice made all the difference in the world to them. That in itself was what we look forward to on a regular basis. So I would say, and I'll sum up my little comments here, but I would say that using the telephone, using Zoom, using GoMeet, use whatever platform you have, and emails. And we were learning that some of our seniors have emails, and this really helped to push them to use those more. So I'll stop there with some of the things that we did to try to move forward during the pandemic.
No, that's very helpful, Josine. I can really see that you've been on the edge of adopting technology even before, and that has really helped you even during the pandemic to continue to support the seniors in very creative ways in terms of the broadcast messaging. So I think that's been a pattern we are observing and talking to our community partners as well, and getting creative. The pandemic is forcing all of us to get creative, to be resourceful. But I think there are still some organizations which may not have the luxury of having all the different resources and sustainable funding and budget. So, Beth, I want to understand, like from a city perspective and from the state perspective as well, we can talk about it in 3 different timelines, but when the pandemic happened, was there any urgent funding, and is there continuing policy and advocacy to support the organizations?
Well, yes, and much more needed. So I think what we've all experienced is just a change in how everyone is leading their lives. So be it from the food delivery systems that Josine was talking about and adapting to that, making sure that there's culturally appropriate food, making sure that the food is going out in the right amount. And then how do you fill in that piece that Josine was talking about with those wellness checks? I mean, that's great because so many older adults on the Upper East Side are connected to the Carter Burden Network. But what about all of those others, tens of thousands of New Yorkers who are older, who are not connected into any senior service providers? And then what happens to them, and how can they slip through the cracks? At the same time, we know that the not-for-profits are really up against it in terms of their budgets, because they're not turning people away. If anything, they're opening up their doors as wide as possible and giving. And some of them are better funded than others, but it's still a challenge any way you look at it. Having to pay for PPE, having to have regular testing, all of those things cost money. And we look on top of that, when you look at nursing homes, assisted living, and all of those supplemental ways that people live, all of those facilities, so many of them have been on lockdown. They don't have visitors. People are not seeing their loved ones, which is a terrible, terrible emotional tug. And you talked about isolation. I mean, this is a serious problem. If you live in a walk-up in New York, and you can't get down on your own, and you're not getting the deliveries, and you don't have the technology that you need to get the meals delivered, or to reach out, or to be on Zoom calls, or to be on Facebook Live, or FaceTime people. I mean, this is a really, really terrible time. And for people who don't live with anyone else, it's people who are married or have long-term relationships, they're joking, like, now you know if you're going to make it or you're not going to make it, because, you're with that person. But, if you don't have that person, and sometimes it's better if it's someone you're not getting along with, for sure, and what are the stresses and strains? So ARP is looking at all the systems, how we can advocate for better services, better meal deliveries, etc. What's happening in the nursing homes, how are people being protected, and what's happening in terms of local government and state government actually getting the funding that they need that can then filter down into these community-based organizations. And I have to say, this is a huge challenge going forward. And people who are willing to do advocacy work, and all the organizations that are on this, I would, recommend that they get on the AARP website and get our advocacy alerts, aarp.org/NY if you're New York specific. because we're in for the fight of our lives. I just got off the phone with 2 New York City Council people before jumping on this call, and they don't have the budget, and they are going to have to do cutbacks. And senior services already are the smallest funded services both in New York City and in New York State. And we are the skinny budget that there is. And you cannot cut more from a bone. That's it. So we're going to have to be very, very loud advocacy voices to help our friends, our neighbors, our constituents, and our consumers who use our senior services and those who need come into the tent and use our senior services.
Yeah, no, I think sorry for the technology issue there, but I hope everybody was able to hear Beth, and I really appreciate all the effort that AARP is doing to collectively represent all the organizations, right? To get funding, to get that attention, to support the organizations moving forward as they have to come back and recover and start providing even more services to the seniors. So thank you for that. And I think one other topic that I want to touch on as well is in terms of, as you're saying, the city and the state are trying to provide as much support as possible. And I know there's a lot of other organizations like Social Creatures that are also helping to provide access to technology in the right time when the pandemic started. Because I know, Rose, I'll let you talk about it, but I know Social Creatures was started right around the pandemic. So I want to understand how you started by supporting these different organizations in terms of helping them get access to technology and to adapt. As Josine was saying, technology adoption need to be accelerated during these times.
Yeah, so you're right. We actually formed as an organization right before COVID started. So we very quickly we're very concerned about, how our mission is social connection, and we immediately, as a society, had to socially distance. So we created our Digital Safety Nets initiative in direct response to COVID. And the major goal of that was to get technology access out to individuals who did not have tech, whether that's a smartphone or a tablet or a computer, depending on the individual's needs or what they were more comfortable with. And we wanted to do so largely through supporting organizations. So we actually were able to give donations directly to the community embedded organizations that had forged already these strong relationships with seniors, because we've just seen that that really helps with the uptake of technology, because as we know, tech literacy, tech mistrust are issues. You can't just necessarily give out a tablet and expect a senior to immediately engage. So we wanted to be able to give out a tablet and say, here are all these programs that are available through the Carter-Burden Network, for example. And this is how you can see some familiar faces if you log on to Zoom, and we provided instructions on that. So we've really been focused on giving technology out through the lens of social connection specifically, not just providing resources. Yeah, so it's been an interesting ride. We've been very lucky that we've been able to crowdfund support to do this. The pandemic has helped individuals, I think, have higher empathy than ever on what it means to be socially isolated. So a lot of our donations were funded by the general public that led to purchasing technology. We were also able to strategically partner with tech-based companies. Logitech has been a huge champion to the Digital Safety Nets initiative and have donated a ton of technology that has reached the hands of older adults. So yeah, we are still going as best as we can. And so far we've been able to give out close to 1,000 devices since March in the New York City region.
That's amazing growth and reach over a short period of time. So kudos to you guys for that. And so I think in that regard, now I want to specifically even talk about like the impact of the pandemic on the seniors and in terms of the social isolation and loneliness. And Dorot has been doing a lot of evidence-based work in this area, even before, like for several years before. And we've had a lot to learn from them and impressed with the kind of evidence-based interventions that they've actually put into practice. We know what works and we've done research on it, but to implement it in the real world and make it successful is very tough. So we want to hear from Ellen on that. On that note, I also want to launch a poll at this point to let the audience comment on how they've seen the impact of the pandemic from their perspectives on the older adults as well. Ellen, can you please comment while we have the audience voting as well? We can start this discussion on how Dorot has been particularly focused on helping seniors during the pandemic.
Sure. Yeah, we have done many of the same things as the Carter Burden Network, so it's great to hear that we're thinking alike. Our first step was to immediate reaction was to do check-in calls with all 2,000 older adults that we serve closely. And so we got through that, and basically just to make sure material needs were met, that they had food, that they had meds that they needed, that they had access to health care, and that just let them know that we had a social work team that was there to help them. And then our next step was our second order of, okay, now that you are home and you've got things to eat and you're kind of settling into this, how can we keep you socially engaged and prevent social isolation? And so we went back to the basics, just like Dosine and her team did, but the good old telephone. Since 1989, we have been running our University Without Walls teleconferencing program, which provides a wide range of programming over the telephone to small groups of older adults. And we did outreach on that, and within a matter of a few weeks, we had doubled the size of that program. We did get some funding to expand it, and we asked our facilitators to offer more programs. We've got museum programs, music, art, storytelling, conversation groups, all kinds of programming, and that became very popular. We onboarded several hundred new older adults just within the first few weeks of that program. And then our next step was, of course, to take all of our on-site programming and switch it over to Zoom, which we did pretty quickly. And we're really surprised at how many older adults took to Zoom and could connect to Zoom. And then our third point of intervention was our individual connections, where we use volunteers to visit older adults, and we created a kind of stopgap program called Caring Calls, where as we reached out to older adults, we said, would you like to be in touch with somebody that shares your interests for a weekly conversation? And we got quite a few. To date, we've got about 800 older adults participating in that, and a huge outpouring of volunteers. There are people in the community that during this time really wanted to make a difference and do something meaningful. So we actually had more volunteers than we had older adults to match them with. So we're still catching up and trying to place those volunteers. So those have been our general strategies as we offered, and I'll share some best practices and what we've learned from those, but I'll give us a chance to finish our poll and other panelists to chime in.
Great, thank you so much for sharing that. And do we want to stop polling and share the results? Great. Awesome, so we see that I think everybody, all of us are on the same page here in terms of the impact that's had on the social connections per se. And I think this is also a reflection. I know a lot of the audience here are from community organizations, and we realize this from the front lines, or you realize this from the front lines. But I also see in the extended world outside, who have not previously been caring for the seniors, the general consumers and others still understand the impact of the pandemic, especially on the social isolation and loneliness. So the awareness in general on how everybody has to check in on their neighbors, has to make sure that the older adults that they know of should be checked in on more often, is a reminder through this pandemic. So I think this is an indicator of the increasing awareness from that perspective. So I think I now also want to take a moment to share briefly our reflections here in pictures. I think we've talked a lot about how we've seen the world change from what it was before in terms of, sorry, one second. in terms of the overall in-person interactions that we've had before. So I'm representing the pictures from the various activities from Dorot and CBN and AARP here, who were operating even before COVID-19, on how we had a lot more in-person interactions between volunteers and seniors, and activities in person where they could come together and do exercises and even advocate for things that they matter to them in person. And quickly after COVID-19, as all of you talked about these before, in terms of how we've started to move towards a more remote environment where we are trying to talk to each other via Zoom or via telephones, and trying to keep the seniors fit via more online exercise programs, and also entertainment. I think we want to keep them entertained with music and dance as well through these remote programs. And Social Creatures has been doing a great job with the fitness program as well, to give them more similar exercise programs as even the younger generation who are taking rehab will get from, and therefore are able to meet cross-generational partners who are engaged in the same type of exercise program. So just want to give a brief shout out in that regards of how all our organizations have quickly adapted to this more virtual world, getting creative and delivering content that's interesting and entertaining, and also helping the seniors feel that they can continue to interact with their familiar faces and voices in this remote world. I think so. On that note, I also wanted to switch quickly to talk about some opportunities. But before I go into that, do the panelists want to comment on any of the pictures or the programs here, just for the audience to get some sense of what we are showing?
Yes, I would. I just wanted to thank Social Creatures and Rose and her team. They donated 20 tablets to our seniors, and we were able to share those tablets across all 4 of our senior centers. And we selected seniors who had expressed an interest and wanted to participate, but did not have the technology to do so. And I would like to also say that Rose and her team actually uploaded the programs in Spanish, particularly for our Spanish-speaking seniors. And that just made all the difference in the world. So some of the photos that you see is of our seniors receiving the tablet. So I just want to say thank you for that. And it speaks to the need to have partnerships, because community-based organizations cannot do this in a vacuum. We must partner with other organizations to make it possible to keep our seniors engaged and reduce social isolation.
Great.
Thank you, Dosine. I'm glad that the tablets are in good hands, and that's why we're here. We're here mostly to work with the organizations more so than the individuals. So happy that we could have been of help.
Great. Thank you for that. And so on that note, I want to continue to talk about so there are 2 interesting things that came out of our first session. So number 1, I think we wanted to talk about some key opportunities or learning moments from COVID-19 in terms of how it has informed our practices moving forward, in terms of the key things that would have been a barrier and did not move fast as it would have been in the pre-COVID era. But now I think there's been an acceleration in adoption of technology, or being more inclusive as well. Like the other topic is also around technology divide, and how we want to leverage technology to make it more inclusive to reach all different types of seniors. So I want to touch on those 2 topics moving forward. So first, I want to just take a moment to ask the panelists on what were some top learnings, or what you see as top opportunities that came out of the COVID-19 experience that you've had. And I would like to start with Ellen in that regard, to talk more about how you've seen, you talked about how you were able to get more volunteers and how you had to get more resourceful in getting volunteers to interact with them on Zoom. So can you explain more about the cross-generational concept, and has that had any influence during the pandemic?
Sure. 2 thoughts come to mind. You know, one of them is the technology divide, and I think, you know, we can break the seniors into, if to be really simple, to two groups: those that, or three groups: those that are comfortable already with technology, and there's lots of them; those that are not so comfortable with it but willing to give it a try and have the equipment; and then we've got the third category that really just either don't have an interest or simply don't have the resources or means to get online, the Wi-Fi, the devices, and that, you know, that will have a tough time. So I think it behooves us all to really think about how to serve all three of those groups and be creative with each one. And each one, just because an older adult can get online doesn't mean that they're addressing their social isolation. One of the things we noticed, you know, that I see, there's been an absolute lovely boom in Zoom classes. Every single organization out there, you can, if you're an older adult, you can binge watch Zoom classes all day long. Sometimes I don't even want to work. I just want to look at these amazing programs. So there's great content out there, and the organizations, you know, we've all just done a great job about getting content out there. But I think, you know, now that we know how to do that, and we know seniors are going to get on there, I think our next order of business is to really figure out how to do the best job we can of mimicking social connections. You know, if alleviating social isolation is our mission and what we're all here to do, you know, the opposite side of that is building social connections. So I always like to be positive, you know, and not always say we're alleviating social isolation, but we're figuring out ways for people to connect socially. That makes it a lot more positive. We can all kind of get through our days a little easier with that. So that really just kind of thinking about how people connected before we all had to isolate, and thinking about how we develop relationships, what's important to people, both meaningful, you know, their friends, their family, the people they're close to, as well as those light touch connections. And if we can build in any of those features into our teleconference programs and our Zoom programs, I think that's going to be the direction, because I think we've all figured out we're going to be doing this for a little while. This is not just, okay, one more month of this and vaccine and everybody's back in the centers. We're going to be doing this for a long time. Also, I think we're going to be benefiting from our learning, because there always were homebound older adults who could not get to our centers, who we need to reach this way. So we're going to really, this whole thing, as we talked about silver linings, we're going to get really good at serving homebound older adults. Just a couple of the best practices and things that we've built into our programs is they're not all large audience. Some of them are very small groups. On our teleconference program, we usually have 10 or 12 people. Try not to go over that number. In our Zoom programs, if they're large, we try to do breakout groups to discuss, in small groups, 5 or 6 people, to discuss what the content was. We try to do a lot of series, so the same people jump on that same call weekly and they get to know each other. That helps build relationships. We try to open up the program 10 minutes early, so that as people have gotten to know each other, they can chat and talk to the person in the box next to them. And we've also built in volunteer ambassadors who join, particularly in our teleconference program. You know, when you join a group teleconference program, there's always that awkward time at the beginning where nobody talks and you're not sure who else is on there. Well, that's what the volunteer ambassador does. He or she says, hey, I'm from Duro. Who do we have on the line? Where are you from? How's everybody doing today? Makes connections for people, all while waiting for the facilitator to jump on it for the formal program. So we start those programs 15 minutes early with that volunteer ambassador, and a lot of people look forward to that. They actually jump on the call earlier to do that. So we're just really trying to think about ways to mimic real life while we're all doing this virtually. So yeah.
No, those are all great ideas. Loved hearing all of them. Thank you for sharing, Ellen.
Yeah, sure.
And so on that note, I also want to give a chance for Beth to help highlight, like, what do you see as the opportunities coming out of the pandemic, especially in terms of how we resource different age groups of people to support the seniors, right? I think through pandemic, we've seen, unfortunately, some of the young people have lost their jobs, but how can we help them now recirculate that workforce to support our seniors in any capacity? So it would be good to hear from you.
I'm going to turn that around if you don't mind.
Yes.
Because in fact, it's older workers that are actually bearing the brunt of a lot of the layoffs or being forced into early retirement. For some of them, they're prepared for retirement and it's okay. But I think for the majority, taking Social Security earlier than they had planned to, not having, worked enough years to build up their 401ks where they needed them to be, if they were lucky enough to have that. It's really a problem. And I think probably everybody on this phone knows that if you are an older worker, it's going to be much harder for you if you lose your job to get another job. And in fact, for women who are older women, it's even that much worse because it's the double whammy of both being older and then second of all, they are usually the caregivers. So if they're caring for other loved ones and they're somehow managing it in some way, be it financially or actually themselves doing the heavy lift of that, literally, there's a lot of challenges. And I think we all know, and we've been talking about tech a lot, but if you're out of the workplace, even for just a few months, tech moves forward with or without you. And so if you are out of a job for a year, you've got to brush up those tech skills. And if it's more than that, it's even more so. So really appreciate these programs that are talking about how they're helping people with technology. And I think we need more of that. And we're going to need more job services. And we're going to have to look into age discrimination, because I know we talk about a lot of the discrimination that's out there, but honestly, ageism is the last frontier. And so we need to all look at ourselves, but at the same time, look at policies that will make a difference.
No, I'm glad you turned it on its head, because I think it's a very important point that you mentioned, the need for such programs that are rising in number. We've heard a lot of community partners were obtaining grants to specifically train seniors to improve their knowledge on technology. So I think that tech training classes is not only important for them to connect with others, but also for their survival in terms of jobs and training needs, as you mentioned. So that's a very good point. And on that note, I think the other point is also that in terms of one of the silver linings is, I think seniors who have been left behind before or people who were not as open to come into senior centers or were unable to come into senior centers now have the opportunity to interact with others through these increasing virtual programs. So I think, Rose, that's where your team has been involved in supporting these different organizations. So I would love to hear from you on how you see the opportunity in improving the disparity in terms of the senior connecting with the outer world.
Yeah, this has been a huge silver lining of the pandemic. It's twofold, really. Seniors, not just seniors, we work across ages, but this applies to seniors as well, who are lower socioeconomic status or have disabilities or multiple chronic conditions, were not as able to engage in in-person programming before this. And now, because the pandemic has kind of galvanized a lot of generosity from individuals and organizations, we were able to provide technology. For many individuals, it was the first time they were ever receiving a piece of technology, and they were quite excited about it. So it's been really amazing to see that reaction, really. But then even more exciting than that is it's not just getting the tablet, but being able to participate kind of on an equal level with peers in the same programs, because everyone is being offered programs in the same way right now. So that tech, when you have access to tech, it's a very equalizing thing, right? So seeing that play out has been really, really beautiful. And I think we need to think eventually there's going to be a transition when the pandemic is slowing down. How can we be mindful to be sensitive to that transition as well? Because there is a huge population of individuals that feel included very fully for the first time ever, and we don't want to take that away, right? So that's some important food for thought, I think, as well.
Yeah, no, that's very valid. I think we adapted quickly, but we don't want to lose that as we move forward. So that's a very important point. Thank you. And on that note, I want to understand how seniors are taking to technology, because I think previously they had the option of either using it or not using it, but now they are being more forced or environmentally to some extent to adapt technology. So I want to hear from Rosine on that aspect of how you have seen seniors adapt to technology. But at this moment, I also want to pause and launch a poll to let the audience also answer this from their perspective. And so we can compare notes after that and hear how they are thinking about it. And also a reminder that if you have any questions that you want us to answer towards the end of this conversation, please continue to add them in the Q&A section. So Rosine, I think you, as mentioned before, that CBN, as you've said, is looking at seniors who are in diverse spectrums, right? People who are only using cell phones, people who are capable of using email, capable of using smartphone and tablet. So there's a spectrum even within older adults and their level of comfort in technology and how they use it. And we've even heard of seniors who don't even want to use a cell phone. Like they may not even have a cell phone. They might have a landline. So I think that it's a full spectrum in that regards. So having seen this for a long time, have you seen any change in that spectrum shifting more towards the right? Say if 100% is more adoption of technology by older adults, have you seen that spectrum move towards the right during this pandemic, or is it still moving? How have you seen it?
Well, Burden Network, we started several years ago, as well as many other organizations. We have partnered with Pace University, and we had their tech class came to one of our senior centers, and we did almost like a speed dating kind of thing, and we matched a senior with a student, and we would have a series of tech classes, starting out with how to use your cell phone, actually then moving into a tablet. And so over the course of these years, the interest kept growing and more seniors wanted to participate in the class. We had a wait list for seniors who were looking to join the classes. We also found that the seniors wanted to learn this technology to communicate with families. We had one gentleman where he had not seen his country in a number of years, and through Google Maps, he was able to zero in on where he grew up. And this brought in such an emotional experience for him. In addition, we also had programs set up where we received funding from a philanthropic support to start our Echo Show program. And the Echo Show is one of these portal devices where you can communicate with your family or communicate with a senior center. And we started our virtual case management program. And so we are seeing that the technology is evolving. We've also conducted research projects where we're doing outreach through Zoom. And it's been quite successful. And as Ellen had mentioned earlier, that some of the Zoom sessions, you may have 5 people, you may have 10 people. But what we're finding is that over time, that's starting to increase. And realize in order for them to stay connected, not only with family and friends, but to be able to stay well informed as to what's going on during the pandemic is critically important for our seniors. And when we think about the technology that they are learning, it will not only impact the social aspects, but it also could be transformative in their ability to communicate with their healthcare system. So once they're able to learn how to use the technology, they could go into their charts and their medical charts and make appointments. So I see this as an overall enriching experience and one that is definitely moving in the right direction. And we know Carter Burton, we're thinking about this hybrid model post-COVID, and I'm sure many organizations will be doing the same. So I think technology is definitely on the agenda, and I don't see that slowing down at all. If anything, I see that actually increasing. But we must be able to provide the funding that can help for those who are not able to afford the technology or have the ability to pay for the Wi-Fi and the broadband access. So I think those are some critical points.
No, very well said, Rosine. I think that's definitely all the important points that I think the audience are also feeling. So let's show the poll results. And so the question was, what are the key barriers that have affected the adoption of virtual services by older adults? And we can see a large majority of our audience are also speaking to the same points as Dazine mentioned, especially access to technology being a key barrier and limited technology literacy enabled to adapt to these technologies. So I think these are all important points for us to consider as we continue to develop and adapt our programs and deliver them for our seniors. So far, I think at least in terms of what we've discussed today, we've learned that technology can not only help seniors to access their social programs and stay connected, but also help them train themselves to join the workforce, to help them access healthcare. So there's a lot of positive side to technology that could potentially help the seniors to see the other potential negative sides like trust or privacy and other things to be lower. The benefit versus the risks may be higher for them. So I think this was a very, very interesting discussion. And as Dozine touched there towards the end on how are we all thinking about the future, how does the crystal ball look like for the next 1 year? And as Ellen indicated as well, there's no easy answer to what's going to happen with COVID-19 or whether we are going to be able to come back to pre-COVID era, which may or may not be good because we've done a lot of positive things during this pandemic as well, which we want to retain. So it would be good to hear from all of you on how you are thinking about the future in terms of all the different types of amazing work that you're doing today. So I want to start with Beth in that regards to understand how you started talking about how the different organizations can engage in advocating for things online. And so virtual advocacy is definitely one way, but I'm sure there's a lot of other things that are top of your mind.
Well, first of all, everybody's got to get out and vote, right? And everybody else to get out and vote, because that's probably, that's our foremost power. And by the way, it will be the 50+ voter who determines who the next president will be. And in fact, many are saying it will be the 50+ woman who will determine who the next president will be. So everyone should feel very empowered if you're over 50. But on top of that, I think as we look to the future, we really do have to look at how we communicate with our elected officials, how we communicate with our representatives, with our city council members, with our congresspeople, with our Senate and Assembly people at the state level. And what I was thinking that one of the silver lining for us is it's much, much easier to get an appointment to talk to your official, your city councilman or your state assemblyman or state senator. I mean, they're home all day too. Granted, they got a lot to do, but it's not like arranging to get into their office and making sure they're there and you have an appointment. So I would say this is a heyday for people who like to be advocates, because you really can get a hold of your representatives. They want to hear from people. For the most part, they are very dedicated public service people, and they want to hear from you and what you're seeing. And all of you who are running programs or very involved with programs, I mean, you're the voices that they have to say. So that's what I would say.
Sorry, thank you so much for sharing that. And I agree with you. I think we need to reflect what we have in our hands, which is the power to vote. So that's a very important thing to use in the next few months. And I think at this moment, I also want to launch a poll to let the audience talk to what they're thinking about the future as well, and let them record their answers. And in terms of the other topic that we wanted to touch on is, as we continue to think about this more hybrid virtual and in-person world. So Dozeen, how are you thinking about the different safety standards that COVID-19 has instituted, right? We need to think about a lot more things before we provide even those hybrid in-person services, even if you're not providing more virtual services. So what are those different phases that you're envisioning in which you might start offering some in-person services, and how do you complement that with the ongoing virtual services to provide that full experience or support for the older adults?
Well, at Carter Burton, we had implemented our reopening plan, and we have actually developed a multi-phase approach to reopening. Our very first phase is really assessing what social distancing, the PPEs, all of that we've actually purchased, installed. We have thermometer guns. We're following all of the CDC guidelines. And so we took this approach of opening our administrative offices first. And we've actually, our headquarters is open right now. If there is a senior that is in a crisis or in need, we can then engage with the senior in person at our headquarters. And when we have all the social distancing CDC requirements in place, and it would be by appointment only. Mm. And it would be, if there's something that can be resolved via the telephone or via Zoom, we definitely support that. In addition, we, as I mentioned earlier, through our Echo Show project that we have on Roosevelt Island, we're able to conduct virtual case management. Mm-hmm. Our case manager has an Echo Show in their office. The senior has an Echo Show in their home. And this project started in advance of COVID-19. But what we have found is it's been extremely helpful and useful for seniors to be able to reach out to a case manager if they are in need of services. This is a pilot for us, and I'm sure as we move forward, we're going to find out many other benefits as well. We're also, through this Echo Show pilot, is to set up small social groups for mm-hmm. the individuals that have the Echo Show. So we create a little community that could be helpful. The other idea, we know that it's very important not only for seniors to feel safe and comfortable to re-engage in person, but also our staff. And we are concerned that we want to make sure that all of our staff are educated about the protocols. And we've had general staff meetings, as well as everyone else that could share information about CDC's recommendation. So the key is not only to take care and make sure our clients are safe, but also our staff. Yeah. And that we can have, everyone would be comfortable in starting to re-engage again. And naturally, we have to follow the recommendations of the city and the state and CDC before we can fully engage in home visits or any type of congregate setting or gatherings.
Yeah, no, I think that's a very important point as well, because we know a lot of community organizations have reduced staffing and also have reduced volunteers since COVID-19 because of possibly the safety standards that have been instituted as well. So as we move towards this more resuming services phase, giving that comfort to people that we have a more safe environment where they could return to work will be very important. So I can see how Carter Burton is thinking about this in that regard. So thank you. Go ahead, please. Mm-hmm.
Never really closed. We may not have, the doors may not have been physically open, but we can to provide services through our wellness calls, through our communication. So we would like to say it's more of a resuming, reopening concept. And I think psychologically that brings about a different thought in one's mind.
Yeah, yeah. No, I think that's well said. Thank you. And so on that note, I think one other topic that's interesting when we think about the future is we've heard a lot. I want to hear Ellen's thoughts on this in terms of how the philosophy is, because we've heard that in terms of building social connections, it's more strong, it's more meaningful when it happens in person versus it's happening virtual. And you talked about this already, how you are thinking about creative, again, ways in which to build those meaningful connections by allowing people to have those informal interactions during your events. But how is Dorad thinking about building those bonds as we continue to move towards this more hybrid, virtual and in-person interaction?
Mm-hmm. Well, I think that everybody is different, and we have to acknowledge that older adults are as different as any. We can't lump them into one demographic group with the same interests. So what we try to do is to approach it from all angles and all sides and have all different ways for people to connect. Whether that is, some people simply just prefer a one-on-one conversation and don't want to participate in a big program. Some people want, are interested in different topics. We have, lovely conversation groups, and some people say, I don't want to do that. I want, something else. So I think if between all of the organizations out there, if we offer a wide variety of people, but just keep in mind those basic principles of what people are really after when they attend those kinds of events, I think that we'll all do well in trying to do it. I agree. I think all of us can agree there is no substitute for in-person one-on-one contact. Our volunteers, our friendly visiting volunteers, keep asking us, when is it safe for me to go back in the home? Can I wear a mask? So we just started outdoor. If the older adult is ready and the volunteer is comfortable doing it, find a place to meet on a park bench, both wear your masks. If the older adult can get out, we can do a visit that way. We're just also exploring even technology visits outdoors. Bring your smartphone and you could sit with a volunteer. We can talk you through some basics. Unfortunately, the weather is not cooperating. If we're not lined up with the weather at all. I wish this were June when we could be starting to do this, but slowly just taking baby steps. We're doing what Josine had suggested, that under very limited circumstances when we really must help somebody, we can. And we have a homeless prevention program. Those clients really, we've been serving them face-to-face since, we've never stopped. We just have lots of safety precautions. So we're all just being very cautious, very careful. Their health is the most important thing. I think, there's no magic to it. We just all have to be just really mindful, really careful. Don't rush. We see what rushing can do. We see it all over the country. New York is doing an amazing job of keeping numbers down. Our older adults are relatively safe. And I just hope we can keep it up. And all of us social service professionals just keep the engagement ideas coming for people, and using technology that includes telephones.
Yeah, I can see what you're saying. Being safe and at the same time trying to come out of our cocoon to some extent in a safe environment.
Yeah.
Thank you. So I want to briefly share the results from our audience as well. And I think they are thinking around the same ways as how we are thinking in terms of how the future looks like. I think there's going to be more social programs offered virtually. There's going to be more adoption of technology and learning by older adults. And I think there's going to be more increased access to more diverse older adult populations who were previously not able to access these services because they were homebound or not able to interact with others. So I think this is very valuable. Thank you, audience, for your participation in all the polls. We appreciate your inputs. And on that note of the older adults adapting and learning technology, we can see there's going to be even more demand as we move forward in terms of helping and supporting older adults getting access to technology and helping them learn this technology. So Rose, I think in that regards, I want to understand, how are you thinking about the future in terms of preparing for this increased demand that you might be facing along with your community partners?
Yeah, I will preface with the demand is always going to be bigger than our organization.
Yes.
I think it's ultimately going to take policy level changes to bridge the digital divide. But in the meantime, we will advocate for that and procure technology as much as we can. We're planning to continue to partner with tech companies directly. That has been a very successful way so far to get bulk orders for very affordable, sometimes in-kind donations. And we've had a lot of success when we can leverage the donations in a way that we can provide direct feedback to those companies about how the use of their technology is working or not working, because companies are very interested in innovating around COVID and social distancing right now. So community embedded programs are the front lines, right? So that information is incredibly valuable to tech companies. So we're going to continue with those partnerships. We've also had, the general public has been amazing with this as well, and leveraging social media. And I encourage any organization watching this, if you have social media and you need technology, use that. There are very kind people on the internet, believe it or not. And as much as you can provide, without identifying information, some personal details about the individuals specifically who need technology, it's been more effective in garnering empathy from people who might read a tweet or read an Instagram post and say, I'll give you $200 for a tablet. So, it takes collective effort in the absence of policy. So we're going to continue to try to galvanize that as much as possible.
Yeah, no, I totally understand. I think all of us here on the panel have been stressing a lot on how we need to collectively work together to address this topic. So we totally understand. And I think in regards to the various points that have been mentioned in our discussion, like keeping technology simple and the solutions simple and easy for seniors to adapt, I think that's what our learnings has been. And that's why we've designed the Blooming Health solution to be mainly based on a cell phone text interface. And even for seniors who do not like to use text and cannot use texting, we can try to use automated phone calls, as CBN has been trying, and to help support our various community partners to even take the different virtual programs to seniors. I think bridging that gap in communication, that's the other part where Blooming Health is trying to partner with our community organizations to help them advocate or advertise that in that way on the different programs that align with the senior interests. And even if the program is offered outside their organization, they want to continue to offer that breadth in programs that address different senior interests and diverse focus, as Ellen pointed out earlier. Each senior is different and we need to cater to their needs with the content and the services that we provide. So I think very, very thankful for all your different thoughts on looking into the future and how you're all thinking about it. And Blooming Health has been doing the same, and we continue to listen to our partners in terms of how we can best help them. So on that note, I want to take one question that we have received here. And this came on earlier on in our conversation, but this was around, like, we are in a situation which is probably not unique, but some people have family, no kids, some have most advanced paperwork. And so in terms of the, how can we use a local, trustworthy, reliable, and professional contact in case of emergency? What options do we have if they don't have a geriatric care manager or somebody else nearby? How can they help that particular senior who doesn't have that support network around them in the regional environment where they are? Because we know more and more seniors are living alone and away from their families. So what are the different options that the caregivers have in terms of making sure that they are supporting their seniors? Do any of the panelists have any suggestions for caregivers on how they can think about this? Dozine, can I call on you?
Well, yes, I just want to make sure I understand the question. That
Yes.
The question is from a caregiver's perspective, if they
Yes.
have a loved one in the area that there are no other family members that could reach out to them, what can be done to help them?
So, in a safe and reliable way, because they want to make sure that the support that's being given to their parents or older relatives is being driven in a reliable way. Mm-hmm.
So when I think about the services with the Carter Burden Network, through our case management services, we're able to make referrals to other organizations that can provide that ongoing support. For one, we find that our case managers and case assistants staff become that essential, quote unquote, caregiver for that loved one. We're able, with the permission of the senior, able to communicate with their caregiver. And that's one of the critical points. Yes, you being able to get permission to communicate with a family member is extremely important. Also, if you have the resources to hire a geriatric care manager, that is someone else that acts as your advocate and as your voice. But if you're not able to hire someone of that to provide that service, there are organizations out there, such as ours, that can help to provide that support through phone calls, ongoing communication with a loved one. There's also other organizations that have caregiver support groups. I know that we have also started a caregiver support group for those individuals living with Alzheimer's disease and other dementia. So I would like to say that it takes a village concept in this regard to make sure that the individual is being referred to the appropriate services, and always do the closed loop. Once you refer, you want to make sure that that individual has been helped. So I hope that I answered the question. I don't know if you were looking, if the individual was looking for more specific programs in mind.
Yeah, so one follow-up I have on that is, so the caregivers, if I have a parent who lives in Wisconsin, and I don't know of any organizations I can use in the vicinity, but there is a community organization there, can I request the community organization to provide support to my parent and directly, even, or if it are all your requests coming directly from older adults, or can it also come from their caregivers and then you deliver them with mutual consent, of course, from the older adults?
So typically, from a caregiver perspective, we find that the caregiver is the one that's initiating majority of the requests and the need for service, because many of our seniors may not recognize that they need assistance, or they may not want to acknowledge that they need assistance. So the calls are often initiated by a caregiver. So if there is a caregiver can call Carter Burden Network and say, you know, my father or my mother attends the senior center, and I know that they need help with X, Y, and Z. We can try to reach out to that senior when they are at the center. I'm talking about doing the in-person engagement, or try to make calls to them and make sure that they are being taken care of. So those are other ways that you can also do that. And caregiver support groups are extremely important for caregivers, whether they're local, whether they're a care partner or a caregiver, local or away. There are ways to stay connected through caregiver support groups as well.
Okay, great. Thank you so much. And Ellen, Rose, and Pat, do you have any comments on that question too?
Yeah, I think Dozine's advice was great. I just, I would just say also DeRote has a resource line when we've got a team of social workers that might be helpful. So I would suggest that maybe the person that asked that question could call our resource line as well, and might be able to help them.
Got it. Mm-hmm. Thank you. So one other question that we had in our team as well, like as we started talking to the different community partners about their needs, I think one of the things that became obvious is as more and more programs become virtual, and for example, a senior who's living in Wisconsin can access the program, which is being offered by a New York-based CBO virtually, but like technically, at least based on the technology access. However, so I don't know what are the different restrictions that are there, but are we moving towards a more concept of a national senior center or a senior center that's not bound by regional limits as we move towards these virtual programs, or maybe that is not feasible based on the current structure? So that's a more outward thinking idea that we wanted to test and understand from you all on how you think about it. Ellen, do you want to start?
Yeah. Sure. I mean, DeRote has for our in-person programs has operated with a catchment area of Manhattan, East and West Side. So this has provided an opportunity for us to serve a much wider group. We have no catchment area for our teleconference programs or for our online programs or for our caring calls. Some older adults moved out of the city during the pandemic to be with family, and so they can enjoy our programs from wherever they are. But we've noticed a big spike in people who found out from a friend or in another way found out about our program. So it's lovely to have people in different time zones. I have to say in our teleconference programs, I think there's something really nice about all New Yorkers being on the phone together, and it's a little bit of a sense of community. So I don't think we'll ever lose that New York-centric aspect to some of our programs. In fact, we even have a teleconference conversation program called All Things New York, where people can reminisce about what they love about New York and what their gripes about New York are. So
I'm joining that program
that's just
tomorrow.
Not for everyone.
I'm there.
right there. So I think, but to your point, Kavitha, it does raise an opportunity for us to widen our programs and make programs available to a wider audience and diversify. Mm-hmm.
I'm wondering if there is also a restriction based on the funding sources to some extent. So I think that's where we were starting to wonder if an organization is receiving most of their funding from their city or the state, does that restrict them in any way from offering these programs to a wider audience or getting more wider reach? Or how do you see this concept evolving in general beyond what I'm describing as well?
I really can't answer the funding question because I don't know their contracts, and I wouldn't venture into answering that. But I would say, here's the other silver lining: we are all in the same room. Everyone in the country is all in the same room. Albeit we might be in different time zones, but we are all in the same room, which we've never had this before. So how we're able to share things and take advantage of some of the wonderful programming that's been raised today. I didn't talk about AARP's programming, and we also do a lot of fun events, and we also do a lot of great training for our volunteers and others in terms of how to be a good advocate. And we've done quite a bit of technology training too. And I would mention OATS, Older Adults Technology Services here in New York City. And their programming is just sensational. So I'd look into that one more time. It's OATS, Older Adults Technology Services. If you don't know about it, you need to look them up. And so I guess that's my answer. So
yes,
we can all take advantage. We can all have fun, together and learn together.
No, very valid. Thank you so much for sharing that. Go ahead, Josine, please.
Yes, I wanted to just mention that as many people here on the Zoom may be aware, that there's the Administration of Community Living, which covers the senior centers throughout the country. And with regard to jurisdiction, I believe that the pandemic has helped to lift that veil, so to speak, by having these Zoom classes, being able to share information with fellow colleagues from around the country. That is really supported And I don't really know of per se the jurisdiction. Yes, there are contracts that organizations and particularly senior centers are responsible for within their catchment area. But I do think, to Beth's point, that we all are in this together. So we are trying to figure out how we can maximize all of our resources. So the future is really interesting in that regard, to sharing more across the country now that we are using more technology to do so.
No, that's a very positive note to end this webinar. So thank you so much for sharing that, Dozeen. So we are all totally on board with you. I don't think there should be any restriction in terms of how we can share our learnings and even our resources and events across the country and across the globe if possible. So thank you so much for sharing that thought. And I totally agree with you. So thank you to everybody who's on the panel and to the audience who joined us today. I think this was a great discussion, a lot of rich insights, and hopefully it benefited all of you who joined this webinar. And we wanted to close by saying thank you for your time. And if you have any questions and would like to continue the conversation with the panelists as well, as we move forward. And if you want to receive their contact information, we are happy to share them with you with your permission. And you can contact Blooming Health at team@glowboominghealth.com. So thank you once again for joining. And the panelists, I want to give a few seconds for you as well to share your closing words. Thank you so much for joining, Rose and Beth and Ellen and Dozeen. Any closing thoughts from your end that you want to end with? Go ahead, Dozeen.
I was just going to say, when we think about future of aging services, I think we have clearly identified that we have to rethink the current model. The pandemic has really helped us to face that reality. And I think that as we think about these hybrid models of in-person and online engagement are critical. And what strategies can we use to reduce that digital divide? Because that digital divide is critical across all of our communities, especially for the low-income and vulnerable population. Technology education is, we've talked about that throughout this entire webinar today, and we know the importance of that. But looking at how can we provide this one-on-one case management, to help the seniors get the services that they need. And we need to start reimagining and rethinking various platforms that are more uni-focused and siloed versus being more integrated, because that's the other big challenge that we have. Mm-hmm. Creating a greater presence of smaller online senior communities where people feel safe to have a conversation and they won't be interrupted or feel as though what comments they make will then be posted someplace on some larger social media network. So I think those are some very critical things to think about for future services in aging.
A lot of food for thought. Thanks, Dozeen. Ellen?
And I'd just add this: the other downside of this pandemic is it's really put the older adults, because they're at increased risk, as a separate part of our society. So I think we all have to think about how to keep us integrated intergenerationally. And if we have to do that on Zoom, let's make sure that we do programs that bring people of all ages together in conversations, because we need to just remind everyone that we are all a society, and that it's not just the elderly need to stay in their homes while the rest of us can start going out. So we just have to make sure that we're integrated and creative with our ways of connecting generations.
Yeah, we need to improve that sensitivity. And as Beth mentioned before, the concept of ageism, we need to be very cognizant of that. So Beth, what are your closing thoughts?
I just wanted to underscore what Dozine said before about the disparities that we see in multicultural communities, and when you overlay that with the ageism, you know, I think we all have to be more aware, because for everything that we're talking about in terms of the needs, they're just exacerbated now in these times of COVID for older adults in multicultural communities. The struggle to pay the rent, the struggle to put food on the table, the struggle to take care of your families. You know, it's just, and the workplace pieces that I mentioned before. I mean, each of those issues just become magnified if you're in a community where income is lower, education is lower, and discrimination is rampant.
Very well said and totally on point. Thank you. Rose, thank you so much for your help and support in putting this webinar together. So do you want to finish with your closing thoughts?
Yes, thank you. My final remarks, I think, relate to just kind of challenging us all to, as we, you know, piggybacking off of Dozine's comment of, I think we need to rethink the model moving forward. There's lots of interdisciplinary approaches we can draw from. A major one that we've been reading a lot about is universal design. So this is used in architecture and education. And I think as much as we can think about designing programs for seniors through the lens of universal design, this is going to enable everyone, regardless of age, size, ability, disability, to engage to the greatest extent as possible in programming. And we've been doing that with Sitness, and we've seen that all ages are attracted because of that universal design. We have young people join all the time who have ankle injuries. They're athletes who are recovering from injuries, Olympic level athletes. So I just challenge all of you to kind of just read a bit about that and think creatively as you're rethinking moving forward.
Yeah, no, I think we definitely need more cities that are redesigned for ageism, for different age groups and disabilities. And so totally agree with that concept of universal design. Thank you for sharing that. And thank you once again, everybody, for joining and sharing your thoughts. Appreciate your time once again. Have a wonderful day and hope to see you in another webinar from Social Connections.
Thank you.
Take care.
Thank you, Kavitha.
Thank you.